Thank you, Mr Evans, and it's an honour to serve under your chairmanship. And I thank the Honourable Member of Pressley, Pembrokeshire, for securing this important debate and his passionate speech, raising important concerns of the challenges faced in the developing world and the many lives saved in vaccination programmes and the huge economic impact to society as a whole, making the argument for UK aid and its impact. And I also want to thank honourable members that have contributed to today's debate. The Honourable Member for Strangford, who always passionately speaks of the work done by DFID with its partners and the global impact that it has, and the Honourable Member for Ayr, Carrick and Cumnock, the Honourable Member for Stafford, talking about the importance of investing in vaccines for the poorest as a priority, and the Honourable Member for Dundee West, who spoke about progress and challenges on AIDS vaccination. It is estimated that 2 to 3 million lives could be saved every year if vaccines against preventable diseases were given to some of the world's poorest people. It is a truly shocking statistic that in Africa alone, over 30 million children under the age of 5 suffer from preventable diseases every year, and tragically over 500,000 of these result in death. Let us be clear, we are talking about the completely avoidable, unnecessary death of children. It is a cruel and heartbreaking fact that pneumonia, an entirely preventable disease, is now the biggest infectious killer of children under 5, claiming the lives of almost 1 million lives a year. Should any further evidence be needed to steel our resolve in increasing vaccination coverage, the fact that 2 children every minute are dying from pneumonia must surely provide it. And only 7%, just 7% of children in the world's poorest 73 countries receive all 11 World Health Organization recommended vaccines. And should the political will and resources exist to vaccinate these children, hundreds and thousands of lives would be saved. But unfortunately, the proportion of the world's children who receive WHO-recommended vaccines has stalled over recent years. Please can the Minister outline today how the Government is working to address equal access to vaccines to ensure coverage of even the most marginalised of children? And in an effort to address this stall, in May 2017, Ministers of Health from 194 countries, including the UK, endorsed a new resolution on strengthening immunisation to achieve the goals of the 2012 Global Vaccine Action Plan, a roadmap to prevent millions of deaths through more equitable access to vaccines by 2020. The resolution urges countries to strengthen the governance and leadership of national immunisation programmes and improve monitoring and surveillance systems to ensure up-to-date data policy and programmatic decisions to optimise performance and impact. And given the skills and experience possessed by the ONS in this country and the importance of statistical analysis in implementing vaccination programmes, could the Minister update colleagues on how best practice is being shared with action plan partners? Vaccines don't just save lives. They also have a huge economic impact on families, communities and economies. Not my words, but the words of Dr. Seth Barkley, CEO of Gavi, the Vaccines Alliance. The argument that we're reducing health costs that would otherwise be incurred in treating serious illnesses has a positive effect on economic productivity is one to which I fully subscribe. The concept is clear. According to a study published today in Health Affairs, vaccines will help prevent 24 million people in some of the world's poorest countries from slipping into poverty by 2030. And Dr. Barkley states that a healthy child is more likely to go to school and become a more productive member of society in later life, while their families can avoid the often crippling healthcare costs that diseases can bring. The statistics prove the economic value of vaccinations to some of the poorest countries in the world, and according to the WHO, in Africa alone, vaccine-preventable diseases result in a significant annual economic burden estimated at some $13 million. We've already heard today from members that the Johns Hopkins Bloomberg School of Public Health recently conducted research which demonstrated that in every case of death or disability that vaccines help to prevent, for every $1 invested in vaccines, there is an estimated short-term return on investment of more than 16 times in 94 low and middle-income countries, including the world's poorest nations. The figures become even more impactful when wider economic benefits are considered, and with the return on $1 investment increasing from 16 times to 44 times. And from an economic perspective, UK aid funding for vaccinations simply make financial sense by reducing the likelihood of disease outbreaks, the response to which is far more expensive. This economic benefit is, however, under threat if current vaccination levels are not maintained, with the WHO estimating a possible negative impact of some $59 billion over the next decade. It is crucial that governments around the world recognise both that vaccinations are one of the best buys, both in terms of health impact and economic impact, but also the risk to the economies of the poorest nations on earth if we are complacent about immunisation. And with this in mind, will the Minister reaffirm the Government's commitment to maintaining multilateral vaccine-specific funding? Sustainable Development Goal 3 requires an end to preventable child deaths, and vaccinations have a crucial role to play in achieving this. Yet we know that the cost of medicines is pushing another 100 million people a year into poverty. And when Ebola broke out in West Africa in 2014-15, the lack of an available vaccine resulted in devastating consequences for local populations and understandable panic in capitals around the world. And the lack of a viable vaccine wasn't due to a lack of research. Several candidate vaccines had been developed by governments for biodefence purposes, but a simple market failure. The government is a founding member and has supported generously the Gavi pneumococcal advanced market commitment, designed to accelerate the development of key vaccines and increase their availability in developing countries. This has seen a third supplier enter the market to supply pneumococcal conjugate vaccines, the most expensive vaccine in the Gavi portfolio, who are now selling the vaccine at roughly 40% of existing prices. And given this success, what steps are the government taking to promote competition within the wider vaccines market so as to increase affordability? And will the government support Save the Children's call to extend the AMC mechanism to allow funds to be spent beyond 2020? And finally, can the Minister outline the government's plans for future working with Gavi? As we have heard from colleagues from across the House, vaccinations not only save lives, but help to support healthier, more productive populations in the poorest countries in the world. They empower countries' economies to grow and prosper, whilst allowing aid money to be spent more effectively on proactive rather than reactive programmes. And we are rightly proud of the commitment in this country to supporting vaccination programmes in some of the world's most poorest nations. But it is crucial that these programmes are maintained for the long term. Immunisation must remain a political priority, and the UK should continue to be a global leader on immunisation. And of course, vaccines form an intrinsic part of universal health coverage, and I hope to see the UK government publicly championing the principles of UHC within its bilateral and multilateral support, whilst increasing their technical and financial support to help strengthen primary healthcare systems. Child mortality will not be ended without a comprehensive, accessible and enduring vaccination programme. And I would like to take this opportunity to reaffirm Labour's commitment to both ending preventable child deaths and the Sustainable Development Goals more widely, a commitment I'm sure the Minister would like to associate themselves and the Department with. Thank you.